you know that your tongue posture is affecting the way you look? Well, in this video, we're going to talk about what a proper tongue posture should be and how it can affect your face shape, your breathing, and even your confidence and social interactions. So stay tuned. If you don't know who I am, I'm a posture specialist. And this platform is dedicated to giving you the tools for correcting your posture, preventing injury, and improving your quality of life. Now let's get into today's topic, how to fix your tongue posture. Now, when I was in college studying dental hygiene, I remember learning all about this during one of my anatomy classes. We were taught about the ideal resting position of the tongue and how it affects the shape of our oral cavity and our throat. The concept is relatively simple. If you think of the inside of your mouth like a big open space, you have muscles surrounding that space, and if those muscles are chronically tight or chronically relaxed, then that can cause issues with the shape of your face. It can also impact your breathing and your ability to speak. The tongue is one of the most powerful muscles in our body. When we hold the tongue in certain positions, we're able to influence the shape of our oral cavity, which has profound impacts on our health. The primary muscle we'll focus on is called the genioglossus. This muscle originates on the front of your skeleton of your body, the mandible or your jawbone, and it inserts on the underside of the tongue. So this muscle, when it contracts or shortens, pulls the tongue forward towards the front of your mouth, and when it relaxes, the tongue drops backwards. You see, when we're young, infants especially, we tend to breathe through our mouths. Our tongues are resting up against the roof of our mouths, and our rib cages are very flexible and mobile. As we get older, we learn to breathe through our nose, and instead of our tongues resting up against the roof of our mouth, they end up falling back and resting against the back of the throat. So when we breathe through our mouth as a child and as an infant, our rib cage has more room to expand outward, which causes our rib cage to be in this very flared position. Whereas when we start breathing through our nose, our rib cage gets squished inwards because our tongue is pushing against the back of the throat. You see, when we breathe through our nose, air passes through our nasal passages, which humidifies and filters the air before it enters our lungs. When we breathe through our mouth, the air just enters our lungs very dry and without any filtration. So because breathing through your nose is a healthier way to breathe, we learn to do that as we get older. But unfortunately, the position of the tongue falling back towards the back of the throat causes many negative effects, which I'll cover in this video. Ideally, when you take a full deep breath in, your ribs expand outwards, and your diaphragm, which is a large dome-shaped muscle, descends down, and your stomach protrudes outwards. However, when you have a tongue that's pushed back towards the back of the throat, it restricts the amount of air you can breathe in. So instead of expanding outwards, your ribs expand more vertically instead. So it puts more pressure on your spine, which is why many people with this issue experience more chronic pain and headaches. Another unfortunate effect of having a tongue that's pushed back towards the back of the throat is that it can actually shorten and tighten the genioglossus muscle over time, making it harder to stick your tongue out. Over time, the lower jaw can start to protrude outwards because the tongue is pushing against the teeth, which can cause chronic pain in the jaw joint. Another thing is that because the tongue is pushing against the back of the throat, it causes our throat to become narrower, which makes it harder to swallow food. So you may find yourself having to work harder to swallow, and sometimes it may even feel like there's a lump in your throat. That's why many people who have this issue often experience heartburn and acid reflux as well, because the sphincter at the bottom of the esophagus is no longer closing properly due to the narrowing of the throat. You see, when we have a tongue that's pushed back towards the back of the throat, it causes our facial structure to change over time. Because the tongue is pushing against the back of the throat, it causes our throats to become narrower. So instead of having a straight line from the tip of your nose to your chin, the narrow throat creates a step-like appearance where your lower jaw protrudes outwards. Now, when this happens, it not only affects the way you look, but it can also affect your speech patterns. Having a tongue that's pushed back towards the back of the throat can cause distortions in your speech because the tongue is closer to the roof of your mouth. So this can make it harder to pronounce certain sounds, especially ones that require the tip of your tongue, like saying the letter L or R. It can also cause lisping and other speech impediments. In extreme cases, children with this condition may have difficulty breathing while they're asleep, and they may end up snoring loudly or even stop breathing entirely during sleep, which is called sleep apnea. This happens because the airway becomes so restricted by the overly large tonsils and the tongue pushing against the back of the throat that it restricts airflow, especially when someone's lying down. When this happens, it causes them to wake up momentarily to restart their breathing. So now you may be wondering, what can I do to fix this? Well, it starts with becoming aware of your tongue posture. If you place your fingers on the back of your throat, you should be able to feel your tongue pushing against the back of your throat when you're sitting upright. Ideally, you want your tongue resting against the roof of your mouth. Now, many people who have this issue are unaware of it, so they might think they have a lisp, but they don't realize that it's because of their tongue posture. So it's important to first become aware of your tongue posture before moving on to fixing it. The next step is to start doing tongue exercises. By doing these exercises regularly, you can start to reduce the size of your tonsils and improve your breathing. One of my favorite exercises is called the tongue sweep. All you need to do is stick your tongue out as far as you can towards the front of your mouth and then move it from side to side across your mouth, sweeping across your teeth. Make sure you're doing 20 repetitions for each side, so 40 total, and do this exercise 3 times a day. Another great exercise you can do is to press your tongue against the roof of your mouth and hold it there for 10 seconds. You can then take a deep breath in through your nose and then slowly lower your tongue back down and repeat this whole process 5 times. For an added challenge, you can try doing this exercise while standing on your head or doing a handstand. That way, you'll also be working on your upper body strength and flexibility at the same time. Just make sure you do it in a safe environment where you won't injure yourself. Now, while these exercises will help you improve your tongue posture, it's also important to fix your ribcage position. You see, when we have a tongue that's pushed back towards the back of our throat, it causes our ribcage to become more upright and less mobile. This chronic hunching of the ribcage causes the muscles in between our ribs, called our intercostal muscles, to become chronically tight, which can lead to chronic neck, shoulder, and back pain. Fixing the ribcage position will not only alleviate pain, but it can also improve your breathing and overall posture. To fix the ribcage position, you want to do a combination of rib mobilizations and stretching of the intercostal muscles. One of my favorite rib mobilization exercises is to place one hand behind your back and one on the opposite side of your rib cage. Then lean away from that side to pop the ribs back into place. Do this 20 times for each side and 3 times a day. As you can see, having a tongue that's pushed back towards the back of your throat can cause a myriad of physical and psychological issues. By becoming aware of your tongue posture and implementing the exercises mentioned in this video, you can fix your tongue posture, improve your breathing, and enhance your overall quality of life. Remember, small changes can make a big difference. Thanks for watching and see you in the next video.